In coronary artery disease, female and male patients are presenting with different symptoms, whereas in valvular disease, the presentation is rather similar. However, our female patients are usually 10 years older and smaller, and so this is a big difference also when we are talking about their treatment options. Indeed, we see some differences in the surgical treatment of aortic valve patients, female and male aortic valve patients. So there are studies demonstrating us that female patients receive more biological valves because they are older. They receive smaller valve sizes, which is natural because they have smaller anatomies. And they also receive more often a full sternotomy versus a partial sternotomy. And it is to speculate if surgeons might expect more difficulties in a smaller sized patient with the exposure of the anatomy. The main problem we are facing currently is that in most cardiovascular trials, female patients are quite underrepresented. So most of the evidence we have in the cardiovascular field is derived from male patients. And this is also the reason why we think that the Rheia trial is important, to gain more evidence in female patients with aortic valve disease. We are especially interested in the hemodynamics and differences in hemodynamics in the expectedly smaller valve sizes comparing surgery and TAVI in this trial. For successful recruitment for such studies comparing surgical and interventional techniques, it's very important that all patients are discussed in the interdisciplinary boards. And I think in particular for this trial, most of the patients we included in our center were actually initially dedicated to surgical therapy. So I absolutely agree with Sabine that it's really important to especially include surgical and interventional candidates for this trial.